the opportunities, I think, there are quite a number of opportunities in the healthcare sector in Nigeria. Obviously, we're talking about Nigeria, but for me, it's mostly about Lagos because Lagos is where the hospital is based. And that is the opportunity, seeing the opportunity to provide excellent standards of healthcare for Nigerians in Nigeria. Now having Marcel Ruth will be operational 4 years in December. And I think for me, I was not in Nigeria for quite a long time. So maybe missed the period where there was a lot of patients just basically leaving the country to go abroad for all their care. What we're trying to do now, we're managing to do, I think, is to provide the type of healthcare that patients would receive if they went abroad. So a bit of a reverse medical tourism, I think, is probably what you would be saying. We're being able to provide, certainly in the private sector. So we've been operational just about 4 years. We've seen almost 4,000 patients in Marcel Ruth. We see patients coming from all over the country. We're now seeing patients coming from neighboring West African countries, including Liberia in particular. In fact, the ambassador came to see us because he couldn't understand, what we were providing that would allow the increase in visa applications, for example, for people wanting to come into Nigeria to come and seek medical care. Patients from Cameroon, a few from Ghana. We're now seeing patients coming back from the UK and in the US, and in particular, when patients go for their maybe wellness check or for some other reason, some are visiting relatives, they get a diagnosis made, and if they don't have insurance, then medical care abroad is extremely expensive, particularly in the oncology sector. And what we're finding now is these patients are coming back, and they're actually coming back because particularly in the UK, there are doctors in the UK who are now telling them that they're aware that we exist and saying to them, look, it's better for you to go back and have your treatment at home, nearer your relatives and so on, but also so that you don't run out of money here and run into problems. So I think for me, that's been a huge thing to have that sort of impact, and particularly delivering care for cancer patients. When, the time when they've been diagnosed, it's not the time for them to now be getting on a plane to go to India, South Africa, the UK. And cancer treatment takes quite a long time to deliver. The majority of our patients are being treated for 9 months, sometimes a year, because they require chemotherapy, surgery, and radiotherapy altogether. So if they went abroad, they'll be away from their home, their family, their friends. Most of them will have to stop working at a time when they need the money to pay for their care. So for us to be able to deliver this care in Lagos for Nigerian patients has made a huge difference in terms of them being able to be at home. The other, I think, for me, the positive things, and because in my career, I did a lot to do with teaching and training. I was postgraduate tutor at the London Deanery. I also did quite a bit of research, and what we've been able to set up at Marcel Ruth is actually an active teaching program. And in fact, in the last few weeks, we've just been accredited by the National Postgraduate Medical College to run a residency program for oncology, for clinical and radiation oncology. We'll be the first private hospital to be giving this opportunity. So again, fingers crossed, we'll not just be reversing medical tourism, we'll be reversing the workforce feeling that they have to leave the country to go and train abroad. So that's another thing. And it's just so much, really, I think, in terms of being able to improve healthcare. I think the challenges we can talk about obviously the challenges in running any type of business in Nigeria. At the moment, of course, we have major issues with electricity and so on, which I'm sure and the cost of treatment, I think, for the general population remains a big one. But I think there are other people on this panel who are more experienced in trying to discuss the financing of healthcare. But from my point of view, because people always ask me this question, and I can, from the bottom of my heart, say that I think it's probably one of the very best things I've ever done in my life. I'm really grateful to God for this opportunity to be back in Lagos, to be working alongside colleagues who I trained with or not, both in the public sector. I do a lot of work with the associations, the guilds, the medical women's, and so on. And it's huge seeing the amount of work people are trying to do in the public sector with hardly anything to do it with. And so it really should be applauded for it. But like I said, for me, it's been incredible to be back at home and to actually day to day be able to try and improve not just healthcare for patients, but to be able to teach and train. And we're also doing quite a lot in the research and development area, which I think maybe I'll leave for a little bit later on.
Good.
Thank you.
Yeah, thank you, Doctor. And it was important to actually let you exhaust your thoughts in that, because again, you know, sometimes we see doctors and we just think one way. We just consider we're boxing them up into that, you know, that white coat as well as the lights in the room. But as an entrepreneur that you are, because that's really what you are as well. That's why it was important for us to allow you to really exhaust that thought process and really share light from a diaspora point of view, as well as an on-ground, you know, citizen right now who's actually giving back to the community and the sector as a whole. So thank you for sharing those. Definitely will be coming back to you to, you know, with leveraging more specific questions.